The impact of human diversity and determinants of health on postpartum depression. While mental health awareness is increasing across the world, postpartum depression is a prevalent issue that requires healthcare workers to be better equipped to recognize and support their patients. It has far-reaching implications on the well-being of the person as well as the baby. In Canada, postpartum depression affects 10 to 23% of birthers. By understanding the intersectionality of the problem, healthcare providers can thoroughly assess the situation and be prepared to listen to their patients and support them.
Postpartum depression, or PPD, is defined as depression presenting up to 1 year post-childbirth. It is consistent with feelings of anxiousness, fear of hurting the baby, and hopelessness. The determinants of health are the factors in day-to-day life affecting your well-being. In this presentation, we picked two to focus on: income and employment. Human diversity is a broad term encompassing all the ways humans are unique from one another. We chose to explore human diversity in the context of new Canadian immigrants and refugees, as well as the impact of culture. We chose these concepts because we wanted to be nurses that care for every part of the individual above and beyond the medical aspect. Determinants of health relate to the topic of postpartum depression due to the effects of income and low employment on PPD. Human diversity is related to postpartum depression due to the increased risk of immigrants, refugees, and Indigenous individuals of developing postpartum depression.
A common topic throughout the research articles was the effects of low income and difficulty finding employment on postpartum depression. Life pressures, poor quality of relationship, and lack of social supports further contributed. Limitations of transportation and lack of education kept birthers from acquiring better jobs that would decrease the risk. Many felt isolated from family, communities, and social support specific to them. While there is limited research on different ethnicities' experiences, studies found that they are at higher risk due to lower socioeconomic status in general, language barriers, and challenging adjustments to the culture in Canada. These birthers might not have any knowledge on postpartum depression and could potentially have trouble describing their experience. Many cultures shame mental illness and increase stigma around the problem. Culture-specific stressors are also related to increased rates of depression in both immigrants as well as Indigenous birthers. There is a noticeable lack of resources and support for people of various minorities. Many articles stated that a way of decreasing postpartum depression is home visits, as it can decrease the environmental aspects preventing a birther from receiving care, such as childcare or convenient appointment times. During a home visit, support people are also able to be educated along with the birther. Public health nurses play a large role in screening and intervention for postpartum depression.
Healthcare providers need to address the multiple factors that influence a birther's ability to access resources. For example, arranging transportation and financial support for care. We found a gap of insufficient research on interprofessional collaboration and used this as guidance for one of our recommendations. While our core research articles indicated that low income and socioeconomic status made you more likely to develop PPD, there was conflicting piece of data in one article that stated regardless of income, the chance of developing PPD is the same. This indicates a need for further research into rates of PPD across various socioeconomic groups. The main theme that was evident among all of our research was that unequal access to resources majorly impact treatment and recovery with PPD.
Recommendations for nursing care. Number 1, nurses need to be prepared for any situation, no matter the clinical setting. Prenatal care is a great opportunity to bring up the conversation of PPD to pregnant individuals. At this point in the pregnancy care, the nurse should help the patient establish their social support system and give them relevant resources to use in the case of the patient developing PPD. Number 2, nurses are unable to meet all of the needs that a patient has. It would be efficient if the nurse utilized other members of the interprofessional healthcare team, such as a social worker, spiritual care liaison, and medical translator. This would help bring forward the best supports from multiple experts in their designated fields. The third recommendation is utilizing the public health nurse in their roles of home visits. By utilizing one-on-one postnatal care, the nurse is able to provide education and focus on giving each specific family culturally sensitive care.
In closing, human diversity and the determinants of health greatly affect the severity and total cases of postpartum depression and are all intertwined. The literature has multitudes of information on the impact of culture, income, employment, and social supports on the prevalence. There is a need for more data that discusses how nurses can integrate other members of the healthcare team to deliver prenatal and postnatal care in order to be proactive with treatment. Home visits are a great way to screen new patients and to help connect the patients to culturally appropriate care and treatment of the condition.